Hey guys, welcome back to the second part of the Larynx lecture. I hope you've seen the first one, otherwise this one's not going to make any sense to you. I'm sure you're very familiar with the diagram because I've already posted it a couple of times ago in the previous video. So just want you to quickly have a look so we can move ahead to speak about the joints of the larynx. We're going to be discussing the cricothyroid and the cricoarytenoid joints. There is also a small joint between the apex of the arytenoid and the corniculate cartilage, but we don't want to talk about that. It's called probably the arytenoidocorniculate, which is a very funny word, by the way. The cricothyroid joint type, it's a synovial joint, uniaxial. They haven't mentioned if it's pivot, but the way I see it, there is one transverse axis passing through the inferior cornu and the circular facet for the cricoid cartilage. So I would think it's a pivot joint, but I haven't read that anywhere. So you can just, to be safe, call it synovial uniaxial joint. And the movement is controversial as well. Some textbooks say that it's the thyroid that moves down like the visor of a helmet, and some say it's the cricoid that moves up. Either ways, I want you to imagine a helmet and its visor whenever you think about the cricothyroid joint, as you can see in the image on the right side below. The next joint we're going to speak about is the cricoarytenoid joint, which is again a synovial joint. This one, however, is biaxial, and most textbooks mention it as plane gliding. The two axes are a vertical axis around which the arytenoid rotates, and the other axis is an axis, as you can see from the diagram, where the arytenoid cartilage is gliding laterally and medially. We'll study the movements when we look at the muscles a little more in detail, okay? What exactly happens at these movements. The ligaments and membranes. The ligaments and membranes both are made up of fibroelastic tissue. There are extrinsic ligaments and intrinsic ligaments. Now the extrinsic ligaments are the hyo and the thyroepiglottic ligament, which you can see in the right-sided figure. You already know what I'm talking about, right? Thyrohyoid membrane connecting the thyroid to the hyoid. You can see that in the left-sided figure more prominently. You can also see its thickenings in the median and lateral side, forming the median and the lateral thyrohyoid ligaments. Then you have the cricothyroid membrane, which you can see in the left-sided diagram, with its median thickening known as the median cricothyroid ligament, and the criciotracheal membrane connecting the cricoid to the first tracheal ring. Now the important ones are the intrinsic membranes that you can see nicely in the right-sided diagram. You already know about these. The quadrangular membrane is attached to the lateral aspect of the epiglottis as well as attached to the arytenoid cartilage. Its upper free margin is embedded within the arioepiglottic fold, and its lower end or lower free margin is thickened to form the vestibular ligament. The other intrinsic membrane is the cricovocal membrane, also known as the conus elasticus, and its upper free margin is known as the vocal ligament. Between both these ligaments, you can see a little gap which is known as the sinus or the vestibule of the larynx. Have a look at this again, take a screenshot if you like it. Same here. Now this is a beautiful diagram from the 40th edition of Gray's. I'm just going to quickly explain what's happening. I highly suggest you to take a screenshot of this. What's happening is you can see the entire epiglottis, but the left half of the hyoid is cut. You can see the hyoepiglottic ligament. Then you can see that the left aspect of the quadrangular membrane is cut in its middle thirds. Can you see that? It's cut in its middle third. And its lower free margin forming the vestibular ligament is also cut. That's why you see the dark green part of the arrow going inside. That's basically the air passage. Okay, so if you observe closely, since the left lamina of the thyroid cartilage is also cut, through the cut vestibular ligament you can see the other side of the vestibular membrane and the ligament, and below that you can see the two vocal ligaments coming from the vocal process or the tip of the vocal process of the arytenoid cartilage. Those are your vocal ligaments, and the space in between is known as the rima glottidis. We'll be speaking about that shortly. And then you can see the cricovocal membrane below. Now let's talk about the muscles of the larynx. On the left side are all the extrinsic muscles. On the right side are the intrinsic muscles. These are the cricothyroid, the posterior and the lateral cricoarytenoids, the oblique arytenoids and their upward continuation known as the aryepiglotticus muscle, the transverse arytenoids, which is actually not a paired but an unpaired muscle, and the thyroarytenoid and vocalis, and the thyroepiglotticus. Let's have a look at the rima glottis, because all these muscles are going to bring about changes in the shape of the rima glottis, most of these, right? So the anterior 3/5 of the rima is between the two vocal ligaments and it's known as the intermembranous part, and the posterior 2/5 is known as the intercartilaginous part. Forgive the spelling mistakes, I did not make this slide, it's googled and copy pasted. Okay, look at the typical shape of the rima. I'm just going to call it the rima henceforth. Okay, now the cricothyroid muscle. This is the only muscle supplied by the external laryngeal nerve. Origin, upper border of cricoid, insertion lower border of thyroid. It has a straight head and an oblique head, and every time the muscle contracts, according to Grace, it is the cricoid that moves upwards. Look at the dotted diagram on the left side diagram, and what you see is the latter position after contraction of the arytenoid, and you can see that the apex of the vocal process goes backward, creating tension in the vocal cords. Cricoarytenoids. The posterior cricoarytenoids origin from the posterior aspect of the lamina of the cricoid insertion. It goes upwards and inserts on the posterior aspect of the muscular process of the arytenoid cartilage. It hasn't been shown well in the diagram, but you can well imagine that when it contracts, the muscular process is going to come towards the midline, as you can see in the diagram second from left, right? It comes towards the midline. Thus, the vocal process goes far away and it forms a diamond-shaped glottis. When the muscle is maximum contracted, the diamond-shaped glottis is seen, and that is basically the position of the rima in deep inspiration. Next, you can see the lateral cricoarytenoids, which are adductors. So they are adducting the vocal cords, but if you observe their origin and insertion, it's originating from the cricoid and inserting on the anterior aspect of the muscular process. So when they contract, the intermembranous part becomes close to each other, almost closes down, but the intercartilaginous part still remains, right? And this kind of an activity is what is seen during phonation. And as I start talking more and more in a higher pitch, the vocal cords are getting more and more adducted and close to each other. So like they're getting more and more adducted as I speak like this. Next, the interarytenoids. Now the transverse interarytenoids is just one muscle, and it leads to the adduction of the cartilaginous part of the rima. So the medial surfaces of both the arytenoid cartilages essentially come close to each other as the muscle shortens, but there is still a little bit of gap left between the intermembranous part, and that is responsible for the voice of a whisper. Yeah. Then you have the oblique interarytenoids and the area epiglotticus. Both of these, you can understand, lead to the closure of the larynx. Now the areoepiglotticus muscle is within the folds and it acts as a purse string, while because of the cross-shaped structure of the oblique interarytenoids, it pulls the apex of one towards the medial surface of the other and leads to complete closure of both the arytenoids. So you can see the difference between that in the diagram on the left and the diagram on the right. The difference between whispering and a complete closure of the larynx that is perhaps desired just before you're about to cough or expel something out. Next, you have the thyroarytenoid and the vocalis. Now, these are essentially the same muscle. The vocalis is supposed to be the lower, deeper, and medial fibers of the thyroarytenoid. Both of these are the relaxers of the vocal cords. The important thing you need to understand about the vocalis, though, is it does not all insert into the thyroid cartilage. Most of the fibers of the vocalis insert in the vocal ligament itself. Thus, when the vocalis shortens, though the posterior part is relaxed of the rima, now the posterior aspect of the vocal cords is relaxed, the anterior part still stays taut because of the contraction of the muscle fibers itself that are inserted over there. So please remember, the vocalis are the lower and deeper fibers of thyroarytenoid and they relax only the posterior part. And this kind of a movement is responsible for increasing the frequency or the pitch of your voice. That's the vocalis acting. Please take a screenshot of this table. I'm not going to say all of these muscles again. Elevation and depression is no rocket science. I'm sure you can figure that out on your own. The thyroepiglotticus is going to be opening. The arioepiglotticus along with the oblique arytenoids is closing. The abductors are the posterior cricoarytenoid, which are responsible for opening the larynx, hence known as the watchdog. The adductors are the lateral cricoarytenoids that are more responsible for phonation, and the transverse arytenoids that are more responsible for whispering aspect of phonation. And the tensors of the vocal cord are the cricothyroid ligament, hence it is also known as the tuning fork. And the relaxers are Vocalist and thyroarytenoids. I hope this is clear. Let's move on to the next thing. The laryngeal cavity. Now I'm not going to speak a lot about this. It's essentially divided into three things. The thing in purple is known as the inlet of the larynx. It's also known as the Supra Glottis, because the inlet is just the folds, but the walls lead to what is known as the Supra Glottis. And if you trace both of these laterally, you reach what is known as the pyriform fossa. So the purple color is extending laterally on either side. That is the pyriform fossa. It lies inside of the thyroid cartilage but lateral to the supraglottis. That's an important thing. It's known as the smuggler's pouch. Read about it. Next, in green you have what is known as the glottis. Above it has the vestibular folds. Below it has the vocal folds. Inside both of these are the vestibular and the vocal ligaments respectively. And the lateral extension inside is known as the ventricle. And if you would trace the ventricle posterior-superiorly, it would have a little room, which can't be seen here because of the section that it is, but that room has a lot of mucus glands from where oil keeps on dripping, hence it's known as the oil can of the larynx. Also remember that the space between the two vestibular folds is known as the rima vestibuli, and the vestibular ligaments are also known as the false vocal cords, and the space between the two vocal cords is known as the rima glottidis, which we've studied already. And the space is known as the true. The vocal cords are known as the true vocal cords, of course. Also, the true vocal cords are pearly white in laryngoscopy, while the vestibular ligament or the vestibular folds, are pinkish in laryngoscopy. That's how you can differentiate between both of them. Finally, you have in light pinkish color the infraglottis, which is the shape of a truncated cone placed upside down. Here's a slide of the supraglottis. It extends from the root of the tongue, or you can see the upper border of the epiglottis, to the apex of the arytenoid cartilage, which also obviously has the corniculate and cuneiform on top of that. You can see that in the diagram. The inlet is also laterally contributed by the arioepiglottic folds. You can already see that. And the downward extent is till the vestibular folds. It's also known as the laryngeal introitus or the vestibule. This is a diagram from Netters. It's really nice. It just shows how the posterior aspect of the larynx is seen once the laryngopharynx is cut from the midline. So you can see the inlet already, and you can see the arioepiglottis muscles. You can see the transverse interarytenoids. You can see the posterior cricoarytenoid. Can you see that? Yes. And in the midline, you can see the longitudinal layer of the esophagus, longitudinal muscle coat taking origin. You can also see the pyriform fossa actually, and you can see how the internal laryngeal nerve and vessels pierce the thyroid membrane and are traversing through it. You can also see the right recurrent laryngeal nerve ascending upwards from the tracheo-esophageal groove, and you can actually literally see it supplying the posterior cricoarytenoid and then going up and supplying the other intrinsic muscles of the larynx. We already discussed this, don't want to talk a lot about it, but if you observe the diagram on the top right, you can see that upward extension, and that is the oil can of the larynx or the saccule. Everything else is not very important for you all. Let's go ahead. That's just the rima glottidis, again the intermembranous part and the intercartilaginous part, and just the different shapes. So in figure A on the top right, that is the shape that is taking place during normal inspiration. Then part C is due to the approximation of the interarytenoid or the transverse interarytenoids, leading to that little shape that is responsible for the whispering voice. Then diagram B, ignore the right-sided diagram, just look at the left-sided diagram, diamond shaped, that is the deep inspiration. You can see posterior cricoarytenoids causing that. And then you can see diagram D, lateral cricoarytenoids responsible for the inverted funnel shaped rima glottidis, which is something that is seen when you are normally talking. The mucous membrane of the larynx, I don't want to go in details, it's more of a histology topic. It's mostly ciliated columnar epithelium, and the exceptions are in the slide. Epiglottis, arioepiglottic folds, and vocal folds. So just take a screenshot of this and revisit that when you study the histology, okay? I'm not discussing histology of the larynx because this is a gross anatomy lecture. Blood supply and lymphatic drainage: superior laryngeal vessels, branch of superior thyroid artery; inferior laryngeal vessels, branch of inferior thyroid artery. The lymph nodes are the upper deep cervical, lower deep cervical, pretracheal, paratracheal. Diagram is beautiful, screenshot it. Innervation: all the muscles of the larynx are supplied by the recurrent laryngeal nerve except the cricothyroid, that is supplied by the external laryngeal nerve. Sensory supply above the level of vocal folds is taken care of by the internal laryngeal nerve, and below the level of the vocal folds is taken care of by the recurrent laryngeal nerve. Small motor units we've already discussed, and if you want you can remember the autonomic supply. In clinical anatomy, laryngoscopy, that's the top left. You need to differentiate between the vestibular folds and the vocal folds. Then laryngotomy, tracheostomy, read about that. Laryngeal obstruction, you can see Rinke's edema, also known as vocal nodules, on the top right diagram. Happens to singers who sing in a faulty way. Also very common amongst teachers who have to shout loudly because their students won't listen. Hence, please listen. Then you've got a laryngocele in the bottom right diagram. That's something that is very common amongst trumpet players because they're constantly trying to expulse air through a closed glottis, and sometimes air might go inside and lead to this kind of a situation. That mostly that air is accumulating in the sinus of the larynx. You can also see some laryngeal edema in the bottom left. Right, we are going to discuss in detail about recurrent laryngeal nerve injury. Whenever, like for example in this diagram, the left recurrent laryngeal nerve is injured, so the left vocal cord is paralyzed and it lies in what is known as the cadaveric or the paramedian position. That's a position between the adducted and the abducted vocal cord, somewhere in between, because both the muscles are not working, right? The adductors and the abductors. If one side is paralyzed, a person would still be talking but with a hoarse voice. If both the sides are paralyzed, then it leads to what is known as aphonia. Now, if the external laryngeal nerve is injured, only cricothyroid is kind of affected, right? So your voice might be weak, but you can still talk. But with the recurrent laryngeal, especially bilateral, you literally cannot speak at all. Thank you so much for listening. I'm hoping I could just do a quick 3D summarization of the entire lecture. You're staring at Himesh Reshamya, who has a typical voice that comes from his nose, so nasal voice, and we're looking at, I don't know, Farhan Akhtar, isn't that? Yes. Oh, lecture miss hone ka dar bhi to hai. Yeah, that's probably has vocal nodules all year long. Alright, thank you for listening. What you can see here is the hyoid bone and the thyroid membrane. I'm actually going to get rid of both of them. Now you can see the epiglottis. It was connected to the hyoid with the help of the hyoepiglottic ligament. Let's get rid of that. You can see the epiglottis now. Yeah. Let's see what it looks like at the back. This is your thyroid cartilage. Everybody knows that. Right. You can also see the cricothyroid muscle here. Can you see that? Straight and oblique head of the cricothyroid muscle. Correct? You can see it arising from the cricoid and going to the lower border of the thyroid cartilage. Now, here we are looking at the laryngeal inlet. Let's zoom in on that. And what you can see here is the arioepiglottic fold. It's a mucosal fold hiding that, and just underneath that is the arioepiglotticus muscle. Hiding that, hiding this on either side here as well. So you can imagine when these contract, it's going to cause closure like a purse string, right? Great. Now you have the thyroepiglotticus. It's coming from the thyroid cartilage and inserted on the epiglotticus. The fibers are exactly perpendicular to the arioepiglottis, and when they contact, it's going to cause the opening. So I'm going to hide them. Now let's have a look inside. Unfortunately, the vestibular ligament, the quadrangular membrane, these people haven't added all this in the app. I'm going to send them a mail about that, so unfortunately you'll have to refer to the Gray's diagrams for that. What we have here though is the vocal cords, the true vocal cords, and the vocal folds around that. So I'm going to get rid of the vocal folds so you can see the pearly white vocal cords. There you are. Sorry about the vestibular ligaments not found. Then another mistake they've done is they've called this the ventricles of the larynx, but the ventricles of larynx, as we all know, is a space in between both the ligaments, right, on either side. So that's another error. We're gonna get rid of that. Now you've got your vocalis muscle and obviously the thyroarytenoides muscle. Let's remove both of them so you can still see the vocal cords now, and the rima, that's your rima by the way. The intercartilaginous part is going to be between the two arytenoids, right? Great. Let's have a look at the other muscles now, right? First, let's have a look at the X-shaped oblique arytenoids, then the interarytenoids or the transverse interarytenoids, right? Hiding them. Then you can see the posterior cricoarytenoid on either side. It's supposed to be inserting on the posterior aspect of the muscular process. A few fibers also go to the anterior aspect though. And you can have a look at the lateral cricoarytenoid. You know what, we can see that better after the thyroid cartilage is removed. So let's get rid of that. There we go, look at that. So this is your lateral cricoarytenoid. Can you see it? Very nice. Let's get rid of that. So it's attached to the anterior aspect of the muscular process. Here it seems to be attached to the body. Again, another mistake, but you know what it does. And then you already saw the cricothyroid, right? Oblique head, straight head, hiding that. And this is going to be your cricothyroid membrane, hiding that. They did not care to show us the cricovocal membrane, which would ideally be connecting the vocal cords with the upper aspect of the cricoid cartilage. I think that's pretty much it. I hope you enjoyed the lecture. Please leave your comments and your feedback, and see you in the next one. Bye bye.